I'm Dr. Maureen Work. I practice in Clemmons, North Carolina. I've been with AMC since 2003 initially. I took a little break when I moved to North Carolina, but all the principles and tools have worked ever since I've started with AMC, and even during that time that I wasn't, when I was in transition, I still used them, which was very helpful. I've been in the insurance world since the beginning of my practice, and it had gotten to the point in the last several years where I was just not happy with having to talk to people about their insurance versus healthcare and chiropractic and what it can do for them. And so it was a 3-year process of me thinking about it. And I just was like, I don't know, it's pretty scary because you worry about like, who am I going to lose as patients? You know, am I going to make it? Where are these people going to be funneled from? Like, where do I get my patient base? But then as my practice grew and I became more of the maintenance patients, I realized like I was already doing this without the insurance company because of word of mouth. And so after a couple of instances where I was having more conversations about insurance and why somebody has insurance that wasn't paying, I was like, that's it. Because it came down to my staff and myself and the amount of time we're putting into that versus taking care of people and talking health and wellness. And after a 3-year thought process, on January 1st, 2023 was my start date of going cash. And this past year was my best physically, emotionally, and mentally, because I was going back to the reason I went to school in the first place and why I was helping people. And to be able to talk to them about healthcare and chiropractic and the benefits has been huge. And I noticed the stress on my office is better. It functions much smoother. We have people referring because of what I'm able to talk to them about now. So it's definitely improved my referrals. But just the difference in how the office behaves and the energy level in there, people coming in like, boy, this is a little different here. I'm like, because we're concentrating on you, and so the decision was a hard one. It was scary. Like a lot of other doctors, I'm sure, have gone through this. You're looking at your numbers, because on our business side, a hat that we don't like to talk about a lot, like I was working that hard to write that much off. And right now I'm making even better money because I'm helping people with the true reason for chiropractic, understanding all the rules of the insurance world, because you never forget those, but just being able to sit there and talk to them about, this is why you need this and this is where we're going to get to with you. And it's been amazing just giving them their treatment plans and them, saying, I'm on it, I'm committed, telling other people about it. But getting past the fear, which we all have, was the biggest part. And then wrapping my head around, I've already been doing this. I just have to make the change with one small part of it. And I would highly recommend, if anybody ever has any questions, they can always call me and ask, because it was a process to go through, and when you get your head wrapped around it, the process is easier, just like everything we've done, going to chiropractic college, graduating, open a practice. It's that same concept, wrapping your head around, what am I able to do? What am I capable to do? Because I don't think we give ourselves enough credit for what we're capable of. And I think that's where AMC has really helped me, because it's given me the tools that I didn't get in school. And then the confidence, because I can also talk to other doctors that have done it. And I've listened for quite a few years about the doctors that have already gone and moved over to the cash practice and just took care of patients the way we want to. And I think that's the other thing, is a camaraderie of other doctors that I get to talk to and encourage now, which is kind of fun. I think that's my biggest takeaway for this past year. And I'm really looking forward to 2024, because I've already got a new focus. We've already done it for a year, so I know I can improve from here. And now it's just saying, okay, how do we make this even better and help more people?